Hello, and welcome to Yodo. I'm Dr. Sarah Bohm. Today I'm going to present some information about Alzheimer's dementia. There's a new medication on the market, Lecanemab, and I'm going to review a recent article that I read in the AARP bulletin. Yes, I get the AARP bulletin. I started getting it because I wanted to know what my patients were reading, but I continued to read it, and I actually enjoy some of the articles. So this is about the new Alzheimer's medication, Lecanemab. This video was not sponsored by the AARP or any company, and it doesn't reflect the opinions of any government, employer, or business. In other videos, we've provided information about Alzheimer's dementia, the diagnosis, treatment, and management, and this one is going to focus on a new medication that it treats a specific subset of Alzheimer's dementia. Dementia is the catch-all phrase for cognitive impairment. Alzheimer's is a specific kind of dementia, and Lecanemab treats one particular type of Alzheimer's patients. And it's not a panacea. It's not a drug that's going to treat every type of Alzheimer's, and it certainly won't treat every type of dementia. I'll give you a brief review of dementia. Let's look at something completely and totally different, and we'll make a comparison. Think about vehicles. If somebody asks you how you got to work and you told them that you drove, they don't know if you came in a car, a truck, an SUV, you rode a bicycle. They just know that you drove. They don't know if it was a 4-door or a 2-door, what color or what year. And dementia is very similar. It's such a huge, broad category, and just saying dementia does not provide any significant information other than the person that has the illness that's causing them to have this progressive impairment of cognition, and it's a slow loss of their cognition over time. We can understand a tremendous amount by knowing the particular type of dementia a patient has. Vital statistics for death certificates and data collection purposes, World Health Organization, the CDC, and for sure insurance companies and CMS, Medicare, they all want to know, demand to know the type of dementia. They want us to name it. Most of the time, the diagnosis is based on the history of the patient's presentation and the other disease processes. There are tests to confirm, but the history really leads the physician as to what test is needed to confirm it. In addition to this, appropriate treatment is completely and totally dependent on the correct diagnosis. The incorrect medication being administered is not going to assist the patient and can even expose them to unnecessary risks. It will certainly result in an assured disappointment, as there's not going to be a response to the medication. Thus, it's critically important for the clinician to name the type of dementia. There's a video on the channel that goes into much more detail on types of dementia. As dementia has risen in the past 10 years, it's now gone from the 10th leading cause of death down to 5th place. As heart disease, cancer, stroke prevention, and treatments for other conditions have advanced, we've not seen significant statistical improvement in the treatment of dementia. So dementia care and dementia treatment and cure lag significantly behind multiple other disease processes. Dementia is hallmarked by the features that are decreased attention and focus with a decline in language and issues with problem solving and altered visual perception. For many, developing difficulties to manage their emotions, personality changes, those occur as time goes by and as the disease progresses, but strength is not affected. This continues to amaze family members, and they are often falsely reassured because their loved one does not have significant weakness. The patient does have trouble with stability, balance, judgment, and this can result in increasing risk for falls with traumatic injury. So back to the new medication Lecanemab. That's the generic name for a humanized monoclonal antibody medication. It is a lab-manufactured antibody that combines human antibody with that of another mammal. It is administered IV as an infusion every 2 weeks. So it's not something that you just take once and you're done with it. You have to stay on it and maintain that treatment. The medication was approved by the FDA in January 2023 for its use. Several insurance payers have been adding it to their medication list, but it's on the highest tier. And by that, I mean for most patients, it's going to require a step edit or a prior authorization. And those things will have to be completed for approval before the patient can ever expect the insurance company to pay even part of the medication. I don't think any of the insurance companies are paying the entire cost of it because it's a very expensive medication. Thus, to be a candidate for the medication, many tests are needed for its approval. If the test results don't indicate the person meets the stringent criteria and the requirements for the medication, it's not going to be approved for the patient to receive. So it's not something that can just be prescribed based on the clinician's judgment or because the patient or family has requested it. The reason for this is the multiple potential side effects as well as the significant expense of the medication. Estimated medication costs are $8,000 to $12,000 a year, depending on the person's insurance and their pharmacy benefits. The indication from the article, the costs are with the insurance assisting on that expense. This is going to change over time, so the cost may not be accurate for very long. We've all hoped for a straightforward testing and answer for Alzheimer's dementia treatments, and it would be terrific if there could be one medication that would treat every patient with Alzheimer's dementia and at every stage. But that's not true. As with so many other disease processes, it's just a lot more complicated than that. There are multiple types of Alzheimer's dementia. Inside of the disease category, there are subsets of Alzheimer's dementia. So it's just not a one-size-fits-all. And that never seems like that works anyway. The medication Lecanemab does not treat all types, but it does a really good job of treating the subset of patients that have beta amyloid plaque formation. That's a protein that builds up in between the neurons, in between the brain cells, and lecanemab seems to remove that very well. Because the drug is targeted to treat just one abnormality, to be a candidate for the drug, and to have that benefit greater than the risk, is to be a part of a very selective group. Only about 15 to 20% of Alzheimer's patients have pure amyloid plaques. The drug is so new that it's not been used in combination with other medications, so that's why it's limited to this one particular type of Alzheimer's patient. Specifically, to be eligible, it requires a patient to have a confirmed high level of the beta amyloid protein buildup, and this drug treats and removes these large clumps of protein that are deposited between the neurons. Accumulation begins in the hippocampus and the frontal cortex, and that's where most of your memory center is. The medication only treats a patient with the beta amyloid accumulation issues. Complicating the eligibility requirements further, the patient must also be confirmed to be at the very early stage of the disease, and sometimes patients don't present early on. Either they or their family choose to not pay attention to some of the early warning symptoms, and we do have a video on the channel about some of the early warning symptoms. Thus, there's a lot of testing that will need to be done to determine if a person is going to be eligible for lecanemab treatment. Lab work, special imaging studies with specific types of markers, and possibly even a spinal tap to collect the necessary information. The drug on an average will slow the mental decline by 5 months over an 18-month treatment period. The initial studies are only over the 18-month duration because the drug was approved in January 2023. We just haven't had a long-term study on this medication yet. It's just not been completed, but it is underway. Unfortunately, the disease is not stopped by lecanemab, and of course the medication does not have the ability to reverse the neurologic damage that's already done. Once a brain cell is dead, the information that it contained and the brain cell itself are gone. Scientists are working diligently as 8.5 million Americans are forecast to have Alzheimer's dementia by 2030. The progression of this number, of course, is affected over time because treatment of this disease and other diseases are also advancing in their care, changing the trajectory of everything at the same time. The new medication lecanemab does not provide the miracle that we all hoped for, but it is a significant step forward in treating this disease process. It does allow a small portion of patients to have added time of good cognitive function. Nearly 150 medications have made it through initial testing stages for Alzheimer's treatment, only to be not approved by the FDA or Medicare as they did not make the marks in the final clinical trials. And those failed attempts have been important learning steps for researchers, but it does not provide what we had hoped to provide for patients at that point. Also on the researchers' whiteboards are tests for evaluation. Coming in the future will be blood tests that will be available to aid in the diagnosis of Alzheimer's dementia so that treatment can be started early, with hope for these tests to be available in the PCP office, so your regular family doctor could provide those tests for you. It could be sooner, but more likely than not, it's going to take a few more years for these tests, maybe even the next 5 or possibly 10 years. But we want these less invasive tests to be available. We want them to be fiscally responsible and be able to be affordable for people, just like heart tests for a patient and tests for diabetes and cholesterol have become very affordable. Alzheimer's disease advances slowly and steadily over time, and it's in a very predictable and insidious manner. Researchers have gotten a little bit sidetracked by this amyloid treatment path, but they have gained significant knowledge while working on just this one part of the equation. Some of the test groups for other medications have been really small, and some having less than 10 test subjects in them before those tests were brought to an end. There are just so many things that the researchers are trying to look at in different parts of the country. Based on the knowledge gained by research and during the development of Lecanemab, a few other medications are currently in the pipeline. Researchers are moving away from treating pure amyloid plaque, also looking now toward addressing tau protein issues. The further research may also look at treatments for combination of the intracellular tau and extracellular amyloid. This is part of the ongoing effort to find medications to decrease brain inflammation with a goal to protect cell-to-cell connections and maintain the flow of signals and retain information that's held in the brain. There is often an astounding amount of money involved in these projects that research Alzheimer's dementia. And to develop these medications, we put a lot of money into it. And this speaks to and demonstrates the magnitude of need that we have for managing Alzheimer's dementia. Just to give an idea of cost and scale and the importance of these research projects, let's look at one of the NIH studies, and that's the National Institute of Health. This was a recent grant won by the University of California in San Francisco to evaluate 2 different anti-tau medications being given to 900 patients. Sounds like it's not a very big study, but it's $150 million for this grant because this is an important project. Alzheimer's dementia microscopically is characterized by these amyloid plaques that are around and the tangled tau protein fibers that are inside of the brain cells. And they believe that these cause those cells to not function properly and eventually die. And as they die, more amyloid and more tau protein are formed, causing other cells to also cascade into disrepair. There's a progressive loss of brain cells, and it results in impairment in the connections between the cells and loss of the information from inside the cells. The AARP journal did give some tips at the end of their article to help with decreasing your issues and risk for cognitive impairment, such as managing blood pressure, getting regular exercise, eating healthy, caring for the senses, eyes and hearing, addressing mental health needs, and getting good quality sleep. In summary, Alzheimer's dementia is a disease of the brain with damage first in the hippocampus, which is a key memory area of the brain, and over time it spreads to other areas of the brain, but typically does not involve strength or motor function. It is characterized by the buildup of amyloid plaque around the brain cells and tau protein accumulation inside of the brain cells, with progressing cell death of those neurons. Lecanemab has been approved to treat a subset of patients with very early stage of Alzheimer's dementia, one particular form of Alzheimer's disease. This medication shows significant reduction of the burden of the amyloid deposits between those neurons and extends the patient's cognitive function beyond what was anticipated for the natural course of that disease. Finding the correct medication for Alzheimer's may become more like finding the correct medication for treating blood pressure or diabetes. The right patient will have to be matched to the correct drug and will have to have the appropriate diagnosis to do so. Some disease states that we have criteria for help us narrow down the medication and improve those choices with a growing number of diseases and specialized tests, and Alzheimer's is going to be one of these diseases requiring specific medications to treat it. Currently, there are many tests that need to be taken to determine if a patient is eligible for taking Lecanemab, but if you or one of your loved ones has early signs of cognitive impairment, don't delay in getting evaluation done. At this point in time, there are medications available for more advanced stages of Alzheimer's, but having time before cognitive impairment becomes significant is truly a gift. I hope that you found this helpful. I appreciate your time. If you have a remark or question, please drop it in the comments below. I want to thank you for staying with me this far. I am having less pain in my hand and it continues to improve. I've got less swelling and a little bit better mobility in my little finger. I do try to behave myself and I'm trying to wear the splint as much as I can. I'm kind of clumsy with just one clunky hand, but I'm doing the best that I can. You have all been very supportive for me and I'm really truly grateful. Thank you. Bye now.